1. GOP's budget rescissions, public broadcasting cuts and impact on healthcare bipartisanship. 2. Trump's $9 billion spending cuts, what you need to know. 1. GOP's budget rescissions, public broadcasting cuts and impact on healthcare bipartisanship. How the GOP slashes to public broadcasting could affect healthcare policy, an unlikely link. In a surprising turn of events, Congressional Republicans pulled off a legislative move in the wee hours of Friday morning, passing a bill to reclaim funds previously allocated for the current fiscal year. This move led to significant reductions in foreign aid and public broadcasting budgets. While no domestic healthcare programs were directly impacted by these cuts, the approval of the so-called rescissions package might have far-reaching consequences for bipartisan healthcare initiatives this year. How so, you ask? Well, let's delve into the intricate web of politics and policy. The recent actions by the Republican Party are likely to sow seeds of distrust among Democrats, who may now hesitate to collaborate across the aisle. The GOP's willingness to backtrack on past agreements has raised eyebrows, and the situation is further complicated by the announcement from White House Office of Management and Budget Director Russ Vought. He hinted at the possibility of another rescissions package being sent to Congress, without revealing its contents. But here's where it gets controversial: the potential impact of these moves on healthcare negotiations. As Democrats grow wary of working with their Republican counterparts, the prospects for bipartisan healthcare measures become increasingly uncertain. And this is the part most people miss: the ripple effects of political maneuvering can extend beyond the immediate targets, affecting unrelated policy areas such as healthcare. To fully grasp the implications of this development, we must consider the broader context of partisan dynamics in Congress. With trust eroded and tensions heightened, finding common ground on healthcare issues becomes a more challenging endeavor. It's a delicate balance that requires careful consideration of the long-term impacts of short-term political decisions. So, what does this mean for the future of healthcare policy? Only time will tell, but one thing is clear: the political landscape is shifting, and every move made by lawmakers has the potential to alter the course of healthcare reform. As we continue to monitor these developments, it's crucial to remain informed and engaged, ready to voice our opinions and advocate for policies that benefit the greater good. Do you think the GOP's cuts to public broadcasting will have a significant impact on healthcare policy? Share your thoughts in the comments below. 2. Trump's $9 billion spending cuts, what you need to know. In a crucial tipping point, House Republicans have just approved a $9 billion package of spending cuts that directly reflects President Trump's aggressive push to shrink federal programs, and this victory could reshape the debate on government size for years to come. But here's where it gets controversial: Congress used a little-known budget tool to sidestep the Senate filibuster and ram the cuts through. This obscure procedure, rooted in a 30-year-old law, lets a president force Congress to take a simple up or down vote on rescinding previously approved funds. By invoking it, Trump has drawn the legislative branch into a rare show of deference to the White House on purse string issues, an area the Constitution specifically entrusts to lawmakers. And this is the part most people miss: about $8 billion of these cuts hit foreign aid programs that were already greenlit by Congress, many of them administered by the U.S. Agency for International Development, USAID. Critics argue USAID has an important role in global humanitarian work, from disaster relief to poverty reduction. Supporters counter that the agency has ballooned over time, sometimes with inefficient or overlapping projects. Meanwhile, another $1.1 billion is being stripped from the Corporation for Public Broadcasting, which underwrites staples like NPR news broadcasts and PBS children's shows. After a heated floor debate stretching into the early hours of Friday, the vote tally landed at 216 to 213. Notably, two Republicans, Representatives Mike Turner and Brian Fitzpatrick, broke ranks and opposed the cuts. To put that in context for newcomers, one of the rare perks of Congress is having direct say over how taxpayer dollars are spent, and these defections underscored how even a small party minority can influence big, high-stakes decisions. Unpacking the sneak peek into legislative drama, before final passage, some House conservatives insisted on an unrelated demand: a promise of more transparency around the Jeffrey Epstein files. For days, Epstein-related disclosures had festered on Capitol Hill, pitting the White House and Speaker Mike Johnson against members who refused to support any major legislation without a commitment to release additional documents. After marathon discussions, the House Rules Committee advanced both the rescissions package and a non-binding resolution calling for more Epstein material, though there's no guarantee that resolution will ever reach the floor. On the heels of the vote, President Trump took to Truth Social, exclaiming, "This is big." Speaker Johnson echoed the triumph. He praised the cuts as a step toward downsizing a federal government he argued is too large, does too many things, and plods along inefficiently. He stressed that Republicans believe in a limited government that's accountable, efficient, and effective for the people. Yet when pressed on bringing the non-binding Epstein resolution up for a vote, Johnson hedged, saying only, "We will see how all of this develops. There's no daylight between us and the White House." Despite critics lamenting the package is $400 million smaller than an earlier version, after senators balked at cutting PEPFAR, the global AIDS relief program, conservatives remain determined. "We're $37 trillion in debt," Representative Eric Burleson of Missouri said. Exposing misuse of funds through this rescission shows some real results. Maybe it's not everything we wanted, but it's better than nothing. Looking ahead, this victory also raises the stakes for the looming battle to keep the government funded past the September 30 deadline. Democratic Senate Leader Chuck Schumer warned that the process has undermined any trust Democrats might have in a bipartisan spending deal. He challenged Senate Republicans' promises of fair negotiations, especially after White House Budget Chief Russ Vought publicly stated he wants less bipartisan appropriations, hinting at a tougher, party-first strategy. Republican appropriators, however, insist that the rescissions package won't derail future funding talks. "If it matters, that's Democrats' choice," said House Appropriations Chairman Tom Cole. Yet skeptics on both sides are left wondering whether mutual suspicion will spiral into another government funding crisis. This episode touches on fundamental questions. How big should our federal government be? When is it justified to repurpose authorized funds? And should a president exploit an arcane budget gimmick to push through controversial cuts? What do you think? Do you side with those who praise smaller government and stricter budget discipline? Or do you worry these cuts undermine vital international and public media programs? Share your thoughts below and let's get the debate rolling.